Hi, my name is Ramin Jalili, and this is my critical assignment for Kinesiology 353, Injury Prevention. So today we will be discussing the sport of basketball and the 3 common injuries which I have chosen to discuss. Before we begin, there's just quickly some factors of injury. One of them being overuse. Overuse is subtle in nature and occurs over time, uh, unlike a traumatic injury, like from a blunt force or landing wrong, something that happens right away. The overuse injury is repetitive. Uh, microtrauma tendons, microtrauma to the tendons and bones, and eventually leads to symptoms which lead to tendonitis, arthritis, and things like that in the knees. So another factor of injury is the environment. Now, cold weather, for example, playing basketball in cold weather, or any sport for that matter, is problematic because we know that cold muscles and connective tissues have less elasticity and are more prone to injury in those situations. So falls and things like that during sports performance increases the likelihood of things like soft tissue injuries, spraining the knees, shoulders, wrists, and even spinal joints. So the environment plays a key role in sports. Another factor is gender. Now I've chosen gender because for example, the female body mechanics and anatomy are quite different to that of the males, and although there hasn't been, studies that show, exactly like this is the exact cause, it's because of their anatomy and their mechanics. There's lots of evidence to kind of suggest that this might be a factor. So some of the things are like higher estrogen levels among females, which gives them less muscle mass, and a little bit more body fat. They have greater flexibility, female athletes and females in general, due to their looser ligaments, and that causes a little bit less power in the muscles. Also, the anatomy, the wider pelvis, it kind of alters the alignment of the knee and ankle, and the narrow space in the knee for the ACL to travel through are all likely causes which make the female athlete more prone to injury than their male counterparts. So let's talk about some of the injuries now. First one is the PIP injury, or the jammed finger in layman terms. This refers to the finger joints. Most common joint referred as the PIP joint, which is the proximal interphalangeal joint. And this is the joint formed by the first and second finger bones. The jam finger occurs because of an injury to the tip of the finger. So usually in basketball, this happens when there's a pass, you're trying to catch a pass, or even, while dribbling as the ball's coming back into your hand. Can happen. Or just going up for a rebound and awkwardly coming in contact with the ball. So the MOI, the method of injury, is by jamming, twisting, or hyperextending. And then some of the assessments are like X-rays can be taken, and on occasion, if it's needed, MRIs and CT scans, depending on the severity of the injury. So we have, real quickly, the preventative and rehabilitative exercises. So preventative, what we can do is strengthen the ligaments in the finger, and one of the ways to do that is doing some grip strength work, and that's all linked into the video. I have a link for that. And a rehab exercise is finger extensions. So the next injury we'll talk about is the patellar tendonitis, which isn't really an injury. It's more like a chronic condition. But now the patellar tendonitis is inflammation of the patellar tendon. It also causes small tears, and it's common amongst people who are involved in sports such as basketball, which require a lot of jumping and running. So assessments for this are physical exams where the doctor will be looking and pressing on the tendon, the actual patellar tendon, looking for pain, and X-rays and imaging tests may be needed, and even MRIs to rule out certain bone issues. So now preventative exercises and rehabilitative exercises for this would be, a preventative would be to strengthen the quadricep muscles. So the vastus medialis, rectus femoris, vastus lateralis all need to be strengthened through different exercises. But for example, knee extensions, the knee extension machine with light weight, that would be a great preventative exercise to have the quadriceps be able to handle the stress of the sport. And then as a rehab exercise, once one does have patellar tendonitis, knee extensions with bands or without bands initially, and then progressing onto bands is a great exercise to strengthen the quadriceps again without too much stress on the patellar tendon. And then the final injury here is we have ankle injuries. And now there are different types of ankle injuries. There are sprains and strains. Usually it's the inversion type, but sometimes there's also eversion. So the most common site is the lateral ankle complex, which is injured in basketball, and that's composed of the anterior talofibular, the calcaneofibular, and the talofibular ligaments, which are usually stretched when the ankle rolls, and these can be injured. And then X-rays of the ankle can be taken to rule out fracture again or bone injuries. And then what happens next is a lace-up ankle brace can be put on for treatment, allowing the athlete to bear weight while the ligaments heal. And then a preventative exercise would be a single leg drive with a 2-second hold. So single leg drive to the toes with a 2-second hold to strengthen the ankle area, the ankle complex. Then as a rehab exercise, basically drawing ABCs to promote range of motion, allowing the ligaments to heal faster and gaining strength. And that is all. Thank you very much.